right, this is a special day for Skin and Bones podcast. It is January 9th, 2022, and we are here recording for the first time in a couple weeks. We've had a little hiatus. Happy New Year. We have the incredible honor to welcome Dr. Daniel Joe to our podcast here. And for those of you joining us for the first time, my name is Peter Gust. I'm a dermatologist, and I'm joined by Dr. Zach Hill. He is an orthopedic surgeon finishing up his training, about to go out to Emory and have a good time in his fellowship. But Daniel and I are done. So yeah, Zach, feel bad.
No,
I'm just kidding.
I'm just still stuck in my trans. Yeah, I know. I still got one more year. Isn't that the kicker?
No, it's okay. We're super happy to have Daniel spend some time with us. One of our best friends from medical school. It's a lot of things I've learned from him throughout my time since I met him, which was basically the orientation to medical school. And we have a lot of good stories pertaining to that. Maybe it'll come up today, but as far as the initiation of our friendship. But how's everyone doing? Zach, you're a little bit under the weather. You want to tell us about it?
Yeah, I have. I got diagnosed with COVID a couple days ago, and the worst part about it is I was on vacation this last week. So my vacation has been set sitting at my house with my beautiful bride, who's also COVID positive. So we've been taking it day at a time and staying locked down. And today I feel like I have the most energy that I've had so far. My symptoms began on Monday. Tuesday, Wednesday, Thursday were pretty much like out of service, like just stayed inside.
Yeah.
Yeah, and it's a weird thing, but today I got up and I took my dog on a 1.5 mile walk away from everyone, just so everyone who's listening, away from everyone. I didn't cross paths with anyone. And then I was pushing a little bit, and I took down the Christmas lights, and I think I'm just I think my body's like, that's good enough for today. So yeah.
Okay. Well, we're glad you're feeling good. And I heard Megan talking yesterday, and she was feeling in high spirits, hopefully.
Well, the thing is I'd rather have what I have right now. I know, Daniel Joe, you had a very rough experience with COVID and what your situation, and I want to dive into that a little bit later. But Daniel, why don't you just tell the people who are watching a little bit about yourself, where you come from, what you do with your life, and yeah.
Sure, yeah. So I'm Daniel. Met these guys in med school. Just finished residency this past summer. Did a dual specialty training in internal medicine and pediatrics. Just finished my peds boards and passed that, and I'm getting ready to sign up for round 2 with internal this year. I'm working completely in the clinic. I work at Loma Linda, and I'm working with residents and medical students and seeing patients mostly in primary care.
Yep. Yeah.
That's awesome.
For those of you who don't completely know what that means, Daniel Joe is a kid specialist and an adult specialist all in one. Not everyone does that. And it's a pretty special track to be on, and it takes a lot of effort, and it's pretty cool.
Yeah, Daniel, and explain that a little bit, because it was the first time really that I heard about that, doing a fellowship in 2 specialties when I was in medical school. And then I heard one of our classmates also went into med psych. And so there's a lot of different things branching from like internal medicine as kind of like the mothership, and then you can branch out and get double board certified. Tell us about that and why you did it, and what does that mean? And obviously dealing with, for those of you who don't know, you're dealing with 2 completely different patient populations in peds and adults. Like, you have to think of them completely as separately. I mean, I'm the easy part. I look at skeletally mature versus non-skeletally mature when I'm fixing fractures, right? It's not that big a deal, but you're dealing with all the physiology, everything. So yeah, Daniel, explain that.
Yeah, so like you, Zach, I had no idea what med peds was before med school. Always had like a leaning towards kids and pediatrics, but had no idea you could even do a combined specialty. So one of our, like the deans, one of the associate deans of our school is med peds trained, Dr. Tamara Shankle.
Yeah.
She's amazing. She is amazing.
I still remember. She's awesome.
She is like a mother figure / role model / brilliant person. It's wonderful.
She was doing tab, right?
I
Wasn't
don't
that like her
remember that.
soda of choice? It was like Tab. I think she always drank Tab, which was like, I've never seen that before. I swear it was something like that.
I
Anyway,
don't
sorry,
remember
Daniel.
that. Yeah, we're interrupting too much.
Oh no. Yeah. But so MedPeds is a little bit different. So if you're right there, Zach.
Yeah, sorry, I'll mute.
That's all right.
Adds to the character.
Yeah, definitely. So if you're looking at your internal medicine specialty, it's usually about 3 years of training versus your pediatric specialty is also 3 years. But instead of doing 6 years, then doing a combined residency is only about 4 years. So it's a little bit crazy because you have to kind of cram 6 years of learning into 4 years. But there's a couple other specialties like that. Like at Loma Linda, we also have like internal medicine and anesthesia. Like Zach was saying, you've seen one of our classmates went on to do the pediatric psychiatry and child psych, and so there's lots of different combined specialties out there, and there's ways that you can combine and kind of condense the training and get a pretty broad and sometimes a little bit more specialized. Like some of the things that MedPeds is known for is taking care of the really like sick kids that then grow on to be adults that most of the adult trained doctors have no idea how to control or how to take care of, because these kids used to die before all the advances in medicine have been made. So that's one of the big things that MedPeds people are kind of niche trained for. And the other thing that I'm working on is also like transitional care and how to take care of just regular kids that are growing up to be adults as well.
Awesome.
Love it. That's awesome, man.
Yeah, that's really interesting that you're dealing with kind of what you said, like a lot of congenital disorders that come from chromosomal abnormalities or defective proteins like cystic fibrosis, like cerebral palsy. I mean, a lot of, even with Duchenne's muscular dystrophy, that's something that we're working on here at UC Davis. Dr. Leshakar is helping out with doing some gene therapy to possibly get rid of that. But the long-term effects of those are unknown. And that's pretty awesome. And just for the listeners, like when we go through medical school, right, like we get some pediatrics and we understand some conversions, but it's a completely different world. And I think that I want to hit that home with that this is so interesting that we have Dr. Joe here with us, is that you're dealing with the way that you dose patients, the medications you can give, the medications you can't give to different patient populations, and then kind of translating that. How did that training, like you said, it's 4 years, it's accelerated. How did you do that? I mean, understanding that is so critical of the dosing and the types of diseases that you're seeing and at what stages. Like how hard was that for you, especially as someone who's married and who's a father now, like to learn all that? Like that is crazy.
Yeah, we want to hear about fatherhood later on. That was my question.
Dang it.
Touch base on that later. Yeah, it's I think the short answer, Zach, is that I'm still learning and I don't have it all down. The pros and cons of the fact that the obesity epidemic is so rampant, especially here in the Inland Empire in California, that most of my teenagers are basically they're adult size. So the dosing really doesn't make a difference as far as like the kids versus the adults. But I also take care of, newborns and babies too. So it's hard. I still have to keep all my reference sheets, and I still look at up to date, and I still look at all these other places too, just to remind myself. And then sometimes I remember, sometimes I forget. But like you guys probably know, you get used to the medications that you used to give in and get familiar with the dosing.
Yeah.
So there's less difference than you think. Yeah, between kids and adults. I think people have a big hang up on that, but there's a difference, but it's not as huge as you might think.
Yeah,
that's because you've gotten your training in it.
That's because dare we say you're good at what you do, Dr. Joe? No, I definitely see the same thing in my practice. I see kiddos and adults as well, but for a very specific relative, like chief complaints and rashes and things on the skin, obviously, because I'm more of a specialist. But you're doing a lot of the jack of all trades pediatricians. They need to make sure you're doing your well checks, and then adults, you need to make sure that they're getting their age appropriate cancer screenings. That's a lot of stuff to remember. That's a ton of stuff to remember. So props to you.
I think that one of the things that you said Daniel, was that, you have your sheets that you still go off of. It's impossible for everyone to remember everything, right?
Mhm.
Like, and I find that at least in my specialty, like when you talk to someone who's like, I am a hand surgeon and they know everything about hand surgery. And I'm like, and then you ask them, you're like, hey, where's the start point for a tibial nail? And they're just like, what? Or how do you get to that? Like they have no idea. Something that a
Mhm.
general orthopedist, but they're so specialized, and it's like
Mhm.
you have to have
Mhm.
something that you can always relate and refer to go back, because you can't remember everything. It's just,
Yeah.
but I mean,
To give our
you're
listeners a
just,
context, Daniel and I just looked at Zach like he was speaking a
well,
foreign language. So I mean, we're all doctors. So to give you any sort of context at all, we were like, what did you
exactly,
just
right?
say?
What did you just say? But for all my orthopedists who are maybe watching this, they're like, oh my gosh, yeah, I totally get it. But what I'm trying to say is that you can get so subspecialized in one area that for the general orthopedics, you forget some aspects of it. You're taking it to a standpoint where you have to know all of internal medicine and all of pediatric internal medicine, and there's no way you can know all that. So it's good to have something where it's like, do you have something that where you're such a specialist that like you're like, oh, I have this app or have this that I kind of like look to look back and be like, okay, that's right, to like kind of get your thinking in order or in line?
I don't know about you guys, but there's I think because my specialty is so broad, there's just too many resources out there.
Yeah,
So finding the right
good
resources,
point.
and for me, it's been building my own like notes and database of information that's really applicable to my practice.
Mhm.
Um, so that's better than just doing a huge PubMed search or something.
Yeah,
Yeah.
you've always been about that too. I mean, ever since med school, I remember you writing out tons of handwritten notes,
Well,
and they're
with the
just like
notes.
beautiful. I would write things down, and I could barely read it, but somehow I would remember it, but in my own weird way. But Daniel's looked beautiful in between his manga sessions.
Still goes on. Still goes
I
on.
love it. You gotta have hobbies, man. Zach and I talk a lot about hobbies on here, but kind of going. We went through so many things. It's hard to narrow it down to just like a couple of things to talk about for one podcast. You being our first guest on here, we're super happy to roll out a bunch of our friends who we want to highlight and kind of want to
Yeah.
praise for what y'all are doing in your careers, but also in your personal lives. I mean, me and you went through long distance relationships throughout the beginning of a medical school, and I mean, I remember so many things that pertain to that. I don't even think we can even open up like a small portion of even talking about that. But now you being a father, I kind of wanted to know what the most surprising thing, or I guess most challenging thing about being a doctor and being a father at the same time would be. I know I'm putting you on the spot here.
Yeah, no, well, you guys know this. Like maybe not about being a father, but the most surprising thing about Addie being born was that she was a girl.
Oh yeah, tell us the
I told you
story.
guys the
This is
story.
an amazing story. We need this on the podcast
Yeah,
if you're
this,
okay telling it.
yeah.
So yeah, so I mean, Addie's almost 2. She's about 1.5. I'm going on 2 now. But we had her at the very beginning of the pandemic during the right before the lockdown. And then for the entire pregnancy, I mean, we'd had, I don't know, something like 7, 8 ultrasounds because our OB was really good and did like in clinic ultrasounds almost every time Patty went to see him.
Mhm.
But every single ultrasound, with the official ones as well, also said, hey, you're going to have a boy. And so we were expecting a boy right up until the day of delivery, wrote his name on the board. And everyone in the room thought that we were going to have a boy until the moment that our OB delivers. And then the one nurse who had no idea is like, congratulations, it's a girl. And everyone was what?
You guys are just like,
So it
I
was
still
like a
remember that
lot of
call.
funny
I
looks
still
going
remember
around
that
the
call.
room.
Daniel
My
called
aunts
me. He's
were,
like, we had a girl.
yeah, but my parents were so super surprised. Patty
Yeah.
was just like shocked, she just delivered a baby. She just, what? So that was
Oh
the most
man.
surprising thing, I
Mhm.
think.
Okay.
We weren't expecting that, and I never thought that I'd be a girl dad, but it's been a super huge blessing, and we just love her.
Yeah, man.
yeah.
It's definitely something that Zach and I are looking forward to in the future, is becoming fathers, and just watching you go through it, and just like make it look easy, just adjusting to that new role. I know there's a lot of stuff that we don't see behind the scenes and we'll eventually understand. But we're so happy for you guys, and it's really cool to watch.
Yeah. How was that? Because you were obviously going into your last year when you had Addie. So you were a third year, right? And then going into your fourth year. How was it being a father in residency? What challenges did that bring? And then how is it being a father now as attending, but still a young attending?
Yeah. It was definitely challenging. There's definitely some big challenges with just time management, working on an extra lack of sleep on top of whatever residency brings you normally. But yeah, I mean, I gotta say it was easier for me being a man than it would be for a lot of my, female colleagues who were mothers during residency. I didn't breastfeed. I was there for a lot of the late nights and the diaper changes and a lot of the crying, but it's a lot more I think on our female colleagues going through motherhood in residency, so it's so much harder. But finding time, I mean, my program was super supportive. I had a lot of help as far as scheduling. Nowadays it's kind of flipped. So Patty's gone to switched from med surg to OR nursing. And so now she's up in the early mornings, which means I'm doing most of the drop offs, but it means waking up, an extra hour early to get up and get the baby ready and get to work on time. So it's a lot of planning ahead, but you make it work.
Yeah. It's very interesting. For those of you who don't know, I actually worked with Daniel's wife during my intern year at the community hospital when I was doing internal medicine, and that was an interesting dynamic when I'm calling her on the phone asking if patients got their meds or how they're doing, and she's like, "Peter, they're in great hands," and I was like, yeah, I know.
That's I mean, yeah, I remember that you bring up a good point. I remember in medical school that we had multiple mothers and people who had children in medical school. And you're right. I think about it from a man's perspective and I'm like, oh man, it's gotta be so challenging. But I do remember specifically looking at those moms and just going, how do you do this?
Yeah.
You are super women,
yes,
for sure.
Agreed.
Yeah, the super moms out there.
Yes.
They are. And they're so intelligent and so caring and so patient and they're just, I don't know how they do it. They're phenomenal at what they do though, and they're amazing moms. So you bring up a very good solid point with that.
Yeah, for sure. I like it. So what else is new, you guys?
Well, yeah, I was just, I wanted to bring up, I think one of the things I alluded to it earlier is, I have COVID-19 and, yeah, it sucks. I'm on vacation, but kind of explain, because Daniel, I remember the one thing I remember other than, Addie coming out a girl, is that what you had to go through in order to be there for your wife during COVID, because when flashback, I mean, this isn't that long ago. This is almost 2 years ago, right? The world was a different place that we were living in, right? I mean, we've talked about it a little bit, but COVID never really bothered us as residents. We just went to work and did our job and did everything. But personal life things, that is bringing your daughter into this world, kind of explain that process, because I remember that was I just remember just praying for you guys and just my heart wrenching for you guys because of everything that was going on.
So yeah, and you're talking about that quarantine, right?
Yeah, when it was first starting, I think.
Yeah, that was a bad time. So yeah, I mean, just the fact that we didn't know a whole lot about COVID back 2 years ago. This was right when things were starting to lock down, things were starting to get pretty bad in the States. So this was when I was in residency, and Addie had just been born. So this is about like late April or so. And so we go and pick up sick patients that are in another emergency room to bring them to our hospital because we have a pretty intense PICU here. So I went out on a procurement for a patient. This was when everything was just starting to lock down. They had done all their screening questions, right? And said, oh, this patient just has really bad diabetes. They had DKA or diabetic ketoacidosis, needed like an insulin infusion. And they had asked them about COVID and if they had been sick, and they had, said no, it probably should be okay. So we picked them up, dropped them off at the ICU. Later on, for whatever reason, they divulged that, actually we had been exposed to COVID. Grandma had just died from COVID a week ago, that they live with. And then, of course, that night she tests positive for COVID, the patient as well. And so meanwhile, me, the RT, and the nurse had all just spent an hour and a half in the ambulance with her, right up in her face. Weren't wearing, I had like maybe a mask, but that was about it. And so back then we were doing, quarantines and everything. Addie's like maybe a couple weeks old. And so I got placed into quarantines. I didn't want to bring it home. Didn't have a way of doing it, quarantine at home. So I got placed, thankfully, in a hotel that was provided. But I spent, 2 of the first 4 weeks of her life separated. Which meant, my wife was alone taking care of the baby all on her own as the first mom. And that was just horrible. And I remember that night, just when I got to the hotel and just had to call Patty and tell her, hey, I'm not coming home. And that just like broke my heart. And I remember breaking down and crying. And it was just the worst day of my life. That was the worst.
Man.
Of all the days, that was the worst.
Knowing how hard it was going to be on her as a new mother, but also I know how much you deeply care for, those around you, and imagine like your own daughter not being there for a couple of weeks, like when she was born. I remember that time too. And
I just remember talking to Megan, like, we haven't been through this experience of having children yet, and God willing we will one day, but like, it's like, as a man, it's like you're not doing anything while your wife's giving birth, and you're just sitting there and you feel so helpless. And then like to have your daughter and your wife go home, and then you're like, I can't help at all because I have to be, it's just like, I can't imagine what that felt like. I'm sorry I had to go through that, man.
Good times so far. Before there were variants, before there was anything, it was just like the unknown. I remember feeling, the closest thing I could equate it to was just like 9/11, the uncertainty of everything. And we don't have we live a pretty comfortable life in the US for the most part. And just whenever something ripples our normal way of life, we kind of feel that. And besides 9/11, I think just like COVID happening and even watching Cynthia and having our loved ones go in and work with COVID patients, and especially our wives who are all nurses and who have all been on like front lines of COVID. And it definitely hit home. And seeing things that could happen to even younger population, and things like MISC, which I saw firsthand before we even had a name for it. And basically what MISC is just like an inflammatory cascade that COVID causes that looks like similar to other diseases. And we didn't have a name for it for a long time. And we didn't know why these children were kind of not doing so well and they were just having like very vague viral symptoms and rashes and things like that. And from a dermatology standpoint, I was seeing that quite a bit, which was really confusing. So Daniel, we are growing. We grow through the hardships, right? And you of all people have taught me that like there's a lot to learn from the hard things in life, and we always have to kind of lean on a higher power for that. And we come from a Christian upbringing, and we know what we believe in and the hope we have as far as a Christian upbringing. And that's always been cool to kind of talk to you guys about and kind of think about it as far as like fellowshipping and things like that. You've always been a role model as far as that goes with me. Just like learning from you a lot about how you include others. You definitely are an includer, no matter who it is. no matter if you have anything in common with them, you're always listening. You're always a fantastic active listener. And I think that leads into my next question for you. What tips do you have for those of us, mainly myself? For anyone who knows me, I am a terrible active listener. I am always trying to solve your problems before you stop talking, and it's not the best thing ever. And I just know there's two people in my life. It's you and my grandpa Larry on my mom's side, who are probably the best listeners I've ever known in my entire life. And I wonder if you had any tips, or if you've learned a couple of things along the way, or if this is just who you are. That's okay.
I think that that point would probably be under debate. I don't know if Patty would agree with you.
Well,
Wow.
But
Wow.
but listening's hard, and I wouldn't say that I'm the best listener either. But
I mean,
yeah, I
there's
mean,
always
you kind of
someone
mentioned
better
it.
than us at certain things. So I mean, from a humble standpoint, I can get where you're coming from.
Yeah. But I'd say, like, I mean, there's a couple areas maybe, because I mean, since we're all doctors, I mean, we all deal with the electronic medical record, and I think that's one of the biggest obstacles to listening when we're talking about being at work.
Mhm.
So in a professional capacity, I'm torn oftentimes between getting things done and getting on to the next patient and really
Yeah.
listening. So
Yeah.
that's a big challenge, and being able
Mhm.
to physically turn away from the computer,
Mhm.
make eye contact with the patient, like, angle my body away from the screen and towards the patient and really connecting with them. That's
Mhm.
one thing that I try to practice every now and then when I can.
Yeah.
Definitely room for growth in that area. And then the other thing that Patty always tells me is I'm not a multitasker.
Well, us men in general, I know that's a super stereotype. So for those of
Yeah.
you who are offended by that, I'm sorry. But honestly, as a male, that, like, I've seen it, and it's true. And we are not as good as the opposite sex.
So
No.
definitely. I've had
Yeah.
to tell Patty, like, if you really want me to listen to you, if I need to hear you, I need to just turn the TV off. I need to, like, look at you and stop what I'm doing. Otherwise, you'll get, like, I can answer you without actually hearing what you say.
That's that's really funny that you say that. I tell Megan, I'm like, if you need a hug right now, just tell me you need a hug. You need to tell me. Like,
Yeah.
yeah.
You need to kind of frame it in a way like, I am dumb. Tell me what to do.
Well, I actually,
Okay.
my next question for Daniel, I actually wanted to flip it, right? Since this is, you're learning about different specialties, is there anything that you wanted to ask Peter and I from a standpoint? We've asked you a couple questions about you being in med peds, and is there anything from our perspective that you had questions for us about, just to
That's a good
involve
one.
the
For sure.
audience?
He's gonna ask us something embarrassing for sure.
Probably.
There's too many things for him to
I
whittle
just think I have
down.
so much respect for all my specialists, because there's just so many times a patient comes in with an issue and I'm just super humbled because I have no idea what's going on with them. And so I'm like, thank God that I have a specialist like, Dr. Gust and Dr. Hill to refer to. You can send you guys questions as needed. I can probably think of like a handful of actual patients just this past week that was like, man, if I knew, if I was Peter, if I was Zach, I would probably have better information for this person, but I just don't.
Yeah. Yeah, man.
Well, I mean, I think the world of medicine is so specialized now because there's always just this evolving amount of knowledge that to just stay in one realm and be very, very good at it is very challenging. And it's just going to become more and more specialized. And it comes with having the understanding of where everyone's coming from and just to be at the best for the patient. I think sometimes we get frustrated with that and just be like, why is this wasting some sort of my time or whatever with another specialty, or why are they being so slow? But at the same time, it's like, this is just, I know you guys have experienced this in residency because you guys just came out, and it's just like, but everyone's doing their job and they're doing it for the better of the patient.
Mhm.
What did you just put on?
I don't know. I just found this up in the room. It's a Happy New Year little
Oh, that's
decoration.
horrible.
Yeah. I have one other thing to ask you guys. I don't know, Zach, have we talked about imposter syndrome at all
Not really, no.
before?
Mm-mm.
Because that's been definitely something I've been dealing with since I've become an attending, and the realization that that's a normal thing and a normal transition when you're dealing with coming out of training where someone's looking over your back, and then like all of a sudden you're making decisions and you're making them confidently out of good judgment, but you still feel like, whoa, it was just like 15 years ago I was playing little league and I never thought I was going to be a dermatologist. It's just like imposter syndrome is a real thing, not just in medicine. I don't know if you guys have felt that. I've made decisions, I've made complex medical decisions for patients which are sound and I mean their standard of care, but in the end it's just like, whoa, when did I become this person making these decisions? And that's kind of what I'm referring to as imposter syndrome. I don't know if you guys have felt that before.
Well, I think it's hard for me to say that now as like a chief resident. I mean, as a chief, you, you know, like you'll indicate patients for surgery in the clinic and then just come out and just say, hey, like I already signed this patient up for surgery. You know, you gotta, this is why. But you always have someone above you saying yes or no, right? So it's like you kind of get this graduated autonomy where it's like, hey, I just signed up 3 patients for surgery. Here's why. And then they go, all right, these 2, yes, I want to, you know, this one, I'm not that sure. And here's why. You always have that. So I can't say at the end of the day that I understand what it feels like to completely like have someone's, you know, full care when there's like a big decision that has to be made.
Yeah.
But I think that comes with time for me. But Daniel, how about you? So I mean, I don't know if I feel like sometimes in that moment I feel like I have imposter syndrome when someone who's bad, you know, 30 years of experience say, I don't think that this is indicated. And you're like, oh shoot, should I be making these decisions? You know, like things like that. But
Yeah,
that's
you
just a
second
part of
guess for
training.
good reason. I hear what you're saying.
Yeah.
Yeah. What do you think, Daniel?
I think, I mean, imposter syndrome is so common. It's just such a regular, natural kind of experience, I think, especially in medicine, because we do have so much authority and it just really, you start to question yourself, like, do I deserve this type of authority? Do I deserve to be making these huge decisions in these people's lives? Am I like smart enough? Am I, you know, well-trained enough, experienced enough to really
Yeah.
be put in this position? I think for myself, thankfully, I haven't experienced as much of that, but I think part of that is from my overall approach of, I think, just recognizing that I am limited and that I am kind of incompletely trained. I feel like there's, because we're always learning, there's things that I've yet to understand or not yet to master. I mean, I have enough information. I did well enough in my training to, I think, to function safely and well, but there's just always something that I'm learning every day. There's just,
Yeah,
there's questions always I'm answering.
for sure there are. And I like that you said it's a natural response. So much of our day in and day out life is how we react to how we feel. And I mean, I feel it a lot. And honestly, like I feel like I'm a pretty good doctor, but there's some days it's like, man, did I make that correct decision? But then when you step back from the whole situation, and Zach and I have talked about this before, it's like the fact that you're actually stepping back and being like, okay, how can I learn from this? Is there something I need to call the patient about right now? Is there something that I can look up to maybe assess whether or not I made the best clinical decision in that time period for that specific patient? And as long as you're questioning yourself and making sure that you're always constantly learning, which you alluded to, I think that that's a good sign. And whether you're in tech sales or anything like this, I mean, we deal with people, we deal with like the human body, we deal with a lot of medications that could either hurt or help our patients, and we're constantly trying to figure out how to do no harm but help people at the same time. So we're in an interesting predicament there, but I like your thoughts on that.
Yeah, and I think I hope that you know, hearing you two talk about, you know, imposter syndrome and the fact that, you know, you constantly go through and you're asking yourselves these questions afterwards. I think that that's a good thing. And I hope
Mhm.
that you guys keep doing that for your whole career, because I think
Yes.
it's when you get to that autopilot mode of, yeah, I got through my day fast, I'm not taking anything home with me.
Hmm.
I think that it's when you get to there that you start making mistakes, or maybe not be taking the best care of patients.
Yeah.
And I think at that level, it's like, well, it's okay. I'm going to make mistakes. I can sleep well at night. I think like all of us would go to bed sleeping very uncomfortably if we made a mistake. And I think what you alluded to, it's the practice of medicine, right? Like we
Hmm.
are human at the end of the day. We're very well trained, but we're human.
Hmm.
But it's that compassion, it's that constant want to get better, that
Yes. Yes.
those mistakes, those errors go down,
Hmm.
but they hit hard, and that's good because they always should, right? Because
Yeah.
that shows that you still have compassion and care. Whereas when you get to that autopilot mode, it's like you might have an error, and it's like, and you don't
Yeah.
learn from it, and
Yeah.
that's gonna happen. It's just we're human. We're not perfect.
Yeah.
Yeah.
On the other side of the coin, you have to be able to set boundaries. Boundaries are a huge thing when you get out of training with your patients. You want to take the best care of your patients, but at a certain point, you have to set professional boundaries. And kind of learning how to set those boundaries is something that I've been kind of negotiating right now and trying to figure out the best way for me to feel like I'm providing the best care, but also setting boundaries for people who have unrealistic expectations, which, as human nature is going to happen.
Yeah, and
And
Daniel,
just,
kind of
yeah.
talk about that, Daniel, but you have to do it from a perspective of you're dealing with patients who are able to consent, and then patients who you have to discuss with the parents to get them on board. Like, how is that what Peter's talking about for you?
Yeah. It's always a challenge. I think it depends on the situation. Part of it's cultural in the way that certain diagnoses are more culturally accepted to be treated with medicines. Like
Yeah.
if you have a pneumonia, that's very well accepted that you should get antibiotics with
Yeah.
bacterial pneumonias. As opposed to, I think, when for all of our mental health like psychiatry colleagues out there, I think that's one of the more challenging things, is seeing patients that just very clearly need some type of antidepressant, and the parents are very reluctant to give medication. So it's always like one of my big struggles is starting people on those types of medications, when being able to, I think, reconcile the patient's condition with the appropriate treatment and why we feel like this is actually the best thing for them. Um,
Yeah.
I think one of the hard things to reconcile is the severity of the patient's condition with the really like appropriate treatment for that, and that's
Hmm.
really something that's difficult for a lot of parents to wrap their minds around.
Hmm. Yeah. Zach, you're on mute.
Sorry, I've been coughing. And that's one of the things I was alluding to, is that, it's one thing, I feel like, to tell a patient that, and then them have informed consent, say, I hear what you're saying, but I'm deciding to go against what you want to do, right? And then it's another thing to where it's like, this patient really doesn't have consent. It's the parents who have consent for the patient, and that's a totally different just emotion and sense to me, because with the adult, it's like, hey, you're an adult, you can make the best decision that you want for yourself.
Hmm.
But with a kid, it's like, hey, like, this could lead to this and this and this, like, can we please get on board?
Yeah, that fine line between CPS and not CPS is very hard, and Daniel deals with it more than me, but I've had my fair share.
Yeah.
Yeah, I don't know.
Oh, any other questions for us, Daniel?
Zach, when's the last time you used a stethoscope?
Oh,
Yeah,
wow.
you don't want to ask me that.
Either of you then, all right?
All right,
Probably.
Zach gets the
So
answer first.
for when we do peds at Shriners Hospital of Northern California, when we sign kids up for surgery and it's their surgical preoperative visit, we have to do a full physical. So the physician has to perform a full physical and listen to the kid's heart and everything like that. And a lot of these kids are extremely healthy, but some of them do come in with some congenital disorders. But usually it's the congenital disorders that like they have to go see the nephrologist and the pulmonologist and all these things to get their medical clearance.
Yeah.
But for these healthy kids, it's like I don't want to miss anything. But yeah, the heart sounds. I had to go back through this.
2018.
So as soon as you
like,
finish your prelim, you hung it up.
Bro, it's like a joke in my office right now because I thought I was going to go into cardiology before med school. So my parents bought me a stethoscope, and so I have a stethoscope now that's just in my office for no reason.
I call it an expensive tourniquet. It's okay.
I actually have two of them. Actually, Cynthia's been using my med school stethoscope, but my Littman that my parents bought me that they engraved and like everything. It's like,
yeah, you never know. You need to go check up on someone one day. You'll be okay.
Man, since I've started working, I've sent like 5 people to the ER. I don't even mess around. Like, yeah, I've sent 5 people. 2 of them very much so needed it, and the other 3 were like precautionary, but the other 2 were like, okay, you don't need me listening to your heart. Let's get you to someone who knows what they're doing.
Yeah. Wow. Okay.
I mean, we're just
question.
staying in our lane. When medicine becomes so specialized, like there's just minutia that I know that nobody's gonna know, and then there's like Daniel Joe, the jack of all trades, and he knows so much stuff that I don't remember, and we got to work as a team.
Yeah.
I've had some interesting diagnoses too, even in private practice. It's fun and scary all at once. All right, Daniel. So the MLS season. So Daniel Joe is probably the biggest United States soccer fan that exists, I think. At least that I know. So how are we going to convince America that soccer is the most popular sport in the world?
During the NFL playoffs, right?
During the NFL playoffs.
Timing's great. It's slowly been happening. I mean, I've been playing soccer all my life. Always loved the European leagues, and then just over the last like maybe decade, really got into MLS. LAFC, Los Angeles Football Club, is my team. So didn't have a great year this past year, but I'm looking forward to the next year. We got some new coaching talent and hopefully some new players coming along. But it's there. And I mean, Peter, you've been to the games. I think that's the biggest
so fun.
thing. The games are so much fun. LAFC, the Bank of California Stadium is such a fantastic atmosphere. There's people jumping and cheering the whole time. It's just a party there.
Yeah.
And,
you can just see Will Ferrell.
Pandemic, but I miss it.
You can see Will Ferrell in his little box just cheering. No, it's definitely fun. I will admit that I'm a huge hater at times. Daniel knows that I'll be a little bit of a troll, but it's an incredible experience, and I've got to experience Austin FC's new team here in their beautiful stadium. It's just like an awesome time, and just constant cheering in the supporter section, and all sorts of flags and drums and all sorts of things. Baseball is going to always be my first love. So it's a different experience from baseball. It's definitely less old school and more new school, but it's fun to watch. I mean, if you think that soccer is not physical, you need to go to a game, because soccer is super physical and it takes a lot of talent. And some of the things that they do, I played intramural soccer with Daniel just for fun and to blow off some steam in med school. And I mean, I've tripped over the ball multiple times and I'm no good at soccer, but watching them do some of the things that they do, and then realizing that like in the Premier League or some of these other leagues, they're that much better. I mean, I think we're catching up, but at the same time, I don't think we're anywhere close. What do you think, Daniel?
The US is we're gonna have our time soon. I think it's coming. I got some hope with the new players. We got a bunch of like 18 to 25-year-olds that are making it big across the globe. We got the World Cup coming up this winter, I think.
Yeah.
a year from now. And then we also, I think in 5 years, we'll be hosting again. So between us and Mexico, we'll be hosting the World Cup. So I think that's going to be a good time, and soccer's going to blow up at that time. But I don't.
Man, you got it so planned out.
Where's the
You
World
know,
Cup coming up?
hey,
Do you-
I hope it happens, by the way. I never would have thought I do enjoy watching soccer, but I only love doing it for the World Cup when I'm watching America.
Yeah.
But like I think the only thing that is keeping it from becoming so big, and I hope it happens, is the capital. And when you look at the United States, it's like you know, Barcelona pays an abnormal amount of money to these amazing athletes, like just inhumane, like when you're making like 60 million a year or 100 something million a year, it's like it's crazy how much they
Yeah,
make.
for sure.
And you know, it's just we don't even have that in football because we have salary caps. But in baseball, I mean, in baseball, there's pretty big, as you know, Peter, like
They make a lot.
Oh,
yeah.
Oh my goodness. Some of these pitcher deals that they got going right
And
now.
that's why baseball is not ever going to go anywhere. Like I don't really like watching baseball unless I go to a game. I don't like watching baseball. Even
I gotta go.
even in the
So
World
Skin and
Series, I don't
Bones
watch it.
is signing off. I
Wow.
will catch you guys next time. I may or may not be quitting because of that comment.
We appreciate when you go to games with you, Peter. Baseball games are fun when you're there.
My favorite
Yeah.
part about baseball is when I taught Cynthia what a balk was. And I ask her every year or so to explain it to me. And
That means a lot.
work in progress. Oh man, she was about to sign me up for a hockey league out here. She's trying to get me back playing hockey, which I miss a lot. Not too bad of a deal out here. A bunch of old guys running around or skating around, hitting each other.
Yeah, hockey,
The disability insurance is already set up, so we're golden.
You're covered.
Yeah, that's my not new sport, but the sport that I love watching is hockey. Love watching hockey.
It's one of the most fun sports to watch because it's just you go out there and you skate as hard as you can for a minute and 15 seconds at a time.
I mean, and they fly.
It's so fun.
How coordinated they are. Like
Yeah.
once you like I've probably been watching it now for like pretty consistently for about 3.5, 4 years. And
Mhm.
like how you can see them set each other up and
So
follow
fun.
the pucks. Oh man, it's pretty phenomenal.
Well, a lot of the same strategy. When I started playing soccer with Daniel, I never played soccer before, but just like kind of the same strategy with hockey and soccer, there's a lot of overlap. I mean, you can't go behind the goals in soccer, but a lot of the same like spacing and like passing strategy. It's just a bigger field, but a lot of the same
But
strategy.
that's like lacrosse. That's what lacrosse is like.
Yeah, they're all very
hockey
similar.
on grass. Just saying.
You're right. I'm not saying you're wrong.
I gotta say, I miss playing sports with you guys. I miss playing volleyball, soccer, everything.
We had
man, the beach volleyball courts. I forgot about those. That was fun.
Cynthia and I went for a hike today and we saw a volleyball court because a lot of the places around Austin here, like people will bring their own nets and set them up at the public parks. And it's kind of hard to find like a sand volleyball court. And I saw one today at like this big park that we went to near us, and it didn't look like anyone was using it in a while. And I was like, okay, we got to get Daniel. We got to get Daniel and Zach out here. Zach was supposed to come visit this week.
Yeah.
We didn't mention it, him and Megan, but they're being cautious. They're doing their civic duty.
We're COVID, like we are
we're full COVID.
Yeah. We're full there.
Never go full COVID.
Recovering, though.
Yeah.
What's that?
I'm just glad you guys are recovering.
Yeah.
Yeah. No, I'm excited too. It was interesting. We're taking off the lights, and one of the former owners of our house was outside with their kids. What are the odds of that, right?
Mm-hmm, mm-hmm.
And we wanted to show them around the house and show them but we couldn't because we're like, we're just getting over this. It's that kind of
yeah.
Mm-hmm.
Oh man. Well, Daniel, any last questions for us? No, otherwise, I think I'm out of things that I was going to bring up today, but the fact that the three of us, the three of us could get together for an hour or so. This is really special on a personal level, but for anyone that would actually listen to us too, but just kind of catching up. And and talking about all this stuff.
I'm honored to be your first, guys.
The first. I texted him earlier this week. I was like, "You want to be the first guest?" He was like, "Yes."
Yeah, Daniel's not one for much. I can't say emotion because he brings emotion, but words,
Yeah.
definitely words. Yes, Daniel's yeses are his yeses and no's are his no's.
Oh man,
Exactly.
Daniel is the only person that could sleep through a lecture and actually retain most of it.
Yep.
Yeah. I still don't know how you did that. Someday you're gonna have to write a course on how to do it. All right, you guys. Well, it's been fun. This wraps up Skin and Bones' newest podcast. I don't even know what number we're on.
6,
Is this 6?
7.
I think it's 6, 7.
6 or 7.
I think we're on 6-ish.
All right.
We're super professional. Thank you guys for listening.
All
As usual, if you have any questions for Daniel or us, Daniel, are you okay if we put your social media on here? We don't have to. Or if you have any questions for any of your kiddos in the Inland Empire, refer them to Daniel Joe over at Loma Linda University Medical Center. Fantastic medical personnel over there, and they'll take good care of you. All right. Don't go see Zach though at Davis. That's probably not the best idea.
Wow.
You're not gonna be there that much longer.
That's harsh. That is super
Oh,
harsh.
that's a joke, but hopefully Davis doesn't come and sue me. Anyways. All right. Well, Skin and Bones is out. It's been real, you guys.